everyone, let's decode the various terminologies of psychiatry, which a medical student must know. So, if you are getting confused about various terminologies in class or nursing care, this video is just for you. So, let's begin with top 100 amazing terms in psychiatry. Part 1. Let's begin. First is abreaction. Have you heard of it? Abreaction. It is an emotional release or discharge of recalling a painful experience. What does that mean? Means when we are suffering from painful experiences, we just apply the emotional release or discharge by recalling it so that there is nothing left inside us. That is called abreaction. This technique in psychotherapy, it brings out suppressed information, unconscious conflict and associated emotions to our conscious awareness so that there is no inner conflict left in us and we are able to express it well. Release of emotion is therapeutic and it can be done with or without medication. So guys, first is abreaction. From the name suggests reaction which is abnormal. So we just have to release our inner painful experiences so that they are not suppressed and inner conflicts are not remain inside us. Now the next is abstinence. Normally, the abstinence means holding or preventing someone from going somewhere. So, abstinence in psychiatry means it is the voluntarily withholding from behavior or use of substances that has caused problems in various dimensions of life like psychosocial. So, the substances which cause problem in our life, we just have to withhold that, so it is a voluntarily. Next is addiction. Addiction is an illness which is characterized by compulsion. Very important word which we have to write in addiction. Addiction is just compulsion of using substances, compulsion of doing something which causes negative consequences or obsession with dysfunction habit. So the definition can be, it is the loss of control or continued pattern of abuse despite perceived negative consequences and obsession with dysfunction habit. So the next is aggression. Aggression, we all know, it means the anger which a person expresses out. So aggression is verbal or physical action for dealing with when a person gets frustrated or anxiety occurred which is caused by not achieved a desired goal. So it is very common and you see in your daily life a person get furious or very disturbed or can go into depression in serious cases when the goal which he or she has set have not been achieved. So aggression is the physical or verbal action which a person uses for dealing with his or her anxiety when the person did not achieve his goal. So the next fifth terminology is agoraphobia. You know the difference between phobia and anxiety? So let me tell you guys, anxiety, it's the irrational fear or the future fear, means that has not occurred but you are feeling very depressed or anxious about the situation or the events which will occur, which can occur in the future. So you get anxiety about thinking of the future events or situation, but The phobia is present, it's not future. Phobia is when you have fear of something. That can be a thing or event or anything. Means phobia of water, which is called hydrophobia, phobia of dark spaces, which is called claustrophobia. So there are many types of phobia which you are that is not irrational or futuristic. Phobia is which you have presently. So agoraphobia is fear of leaving home, fear of entering shop, crowded or public places. In short term, what is it trying to tell you? Agoraphobia is when you are not able to immediate escape to safe area. So like in public places, you are not able to escape because so much is crowded area. Then entering shop, there are also many people, so there is just fear in mind that you will not be able to escape out, or fear of leaving home because everyone safe place is home. So agoraphobia is where it is difficult for immediate escape to safe area. Next is akathisia. You must, if you are a medical student, you must have heard about akathisia. Akathisia, do you remember where have you heard? You must have heard this in extrapyramidal symptoms which occur in patient after taking antipsychotic medications or any disease condition. That disease condition can be Parkinson's disease. So akathisia is the subjective feeling. What is subjective and objective? Subjective is the person feels by itself, and objective is when the another person can observe the patient's signs and symptoms. So akathisia is subjective feeling of motor restlessness which is manifested by a compelling need to be in constant movement. So basically akathisia is to be in constant movement when it is seen in extrapyramidal side effects of antipsychotic medications. So after taking antipsychotic medication, it is seen in many patients that they get extrapyramidal effects, and akathisia is one of them. So we have learned about agoraphobia and akathisia. Next is ambivalence. Ambivalence, we all know what does ambi means. We have studied about we have heard about ambi many times, like amphibian or so ambi means two or bi. So ambivalence is which consists of two opposition impulses. Same thing, same person simultaneously. Means if I am the person, then at the same time I will get two opposite impulses. Like I should do this, but if I do this, this will happen, so I should have done that. So about this and that, both impulses occur in the patient at same time and same person. This is very commonly seen in schizophrenia, borderline personality disorder and OCD. Borderline personality, which is black and white personality, also called black and white personality, then OCD. Next is amnesia. So A means not present. Amnesia from the word suggests loss of memory. So it is partial or total inability to recall past experiences, which may be organic or emotional in origin. This is very common, and same is amnesia, dementia. Dementia and amnesia, there is difference. I'll tell you about dementia ahead. So next is anergia. Energia is, A means absent, so energia means energy means lack of energy for day-to-day activities. Here energy won't come, so energia is lack of energy for day-to-day activities. Next is anhedonia, very common, and you will study about you will come across this word multiple times in your further psychiatric studies. Anhedonia means loss of interest in and withdrawal from all regular and pleasurable activities often associated with depression. So when a person gets depressed, he will lose interest, he will withdrawal from society, friends, and his surroundings. He will not do anything, he will just sit in a corner of the room, and he will be no pleasurable activities in his life. So anhedonia means loss of interest from all regular and pleasurable activities. So today we have just learned about 10 terminologies of psychiatry. So let's recall. First, we have studied about abreaction. What is abreaction? It's the emotional release of painful experience. Then abstinence means withholding, voluntarily withholding of from behavior or use of substances which cause problems. Third is addiction, which means compulsion or inability to control and continued pattern of abuse which can cause negative consequences. Fourth is aggression, which is frustration or anxiety. Next is agoraphobia, which means fear of leaving home, entering shop, crowded places. Next is akathisia, which is a common pyramidal adverse effect, which in compelling need to be in constant movement. Next is ambivalence. Ambivalence means coexistence of two opposition impulses. Then next is amnesia, means inability to recall. Energia, lack of energy. Anhedonia, loss of interest. So this is all about today's video, and we'll continue for next terminologies of our series top 100 amazing terminologies for psychiatry. So thank you, like and subscribe my channel, and stay tuned for more videos.